Hello, my name is Karen Zúñiga. My teacher is John Moscoso. I study in Catholic University of Guayaquil in School of Nursing, Saint Vincent of Paul. I am going to talk about valganciclovir for symptomatic congenital cytomegalovirus disease. Definition: the treatment of symptomatic congenital cytomegalovirus disease with intravenous ganciclovir for 6 weeks has been shown to improve audiologic outcomes of 6 months, but the benefits wane over time.
Cytomegalovirus. El cytomegalovirus es un virus del grupo de los herpesvirus cuya principal característica es que son virus capaces de infectar al ser humano y permanecer latentes en el interior de las células. Se transmite por contacto de secreciones, principalmente por vía sexual, sin causar síntomas de importancia. Un cuadro gripal a veces, y la mayor parte de la población ha tenido contacto con este virus. La reactivación del cytomegalovirus en el ojo sucede cuando el sistema inmune del infectado está gravemente debilitado, como en el caso de los infectados por el virus del SIDA. De hecho, es la causa más frecuente de uveitis posterior y ceguera en los pacientes con SIDA. No causa dolor, y en el fondo de ojo se ven hemorragias y microinfartos de la retina, que dan un aspecto de pizza de mozzarella y tomate. El tratamiento del cytomegalovirus, cuando aparece clínica grave, es el ganciclovir o foscarnet por vía intravenosa. En ocasiones, la inmunosupresión en las personas con SIDA es tan grande que aunque el cytomegalovirus se active, el sistema inmune no le ataca y no se produce inflamación. Sin embargo, cuando se comienza la terapia antirretroviral contra el SIDA targa el sistema inmune mejora y puede aparecer entonces una uveitis posterior. Paradójicamente, forma parte del conocido síndrome de reconstitución inmune.
Cause: infection with cytomegalovirus is very common. This infection is spread through blood transfusion, organ transplantation, respiratory droplets, sexual contact, urine.
A prenatal or a postnatal liver and kidney. But I do know one thing: it's going to show some spectacular diagnostic features. I don't want to blow it up yet, because at first I want you to realize all these glomeruli here are in the kidney, and here's a liver. And as we blow up the liver, we'll go to the liver first. We can see that the overall architecture is preserved. And I know what you're thinking. You're thinking, well, there's some inflammation around this portal tract, and you're right. And in addition, you're thinking, hey, well, what are all these little dotted cells out in the parenchyma? Are those inflammatory cells too? No, they're not. If you remember that the liver and spleen, particularly the liver, is the site of erythropoiesis in newborns, and within a month or so, it disappears and basically all goes to the bone marrow. In fact, before it's even in the liver, it's in the yolk sac in the very early stages of fetal life. So this is a liver that does have portal inflammation, but these little nests of cells out here are hematopoietic cells, normal hematopoietic cells. But nevertheless, there's some kind of inflammatory process going on here. And the reason why I don't want to move this is because it took me a long time to find the diagnostic spectacular feature. You know that hepatocytes in general are fairly uniform. They probably have a nucleolus in the adult stage. Here are some hepatocytes out here. I do not know whether these represent some hepatocytes or bile duct cells. They may very well be bile duct, because it looks to me almost like a little glandular configuration, plus it's in the portal area. But what do we have right here? We have a nucleolus that is very, very blue or basophilic inside of an enlarged, probably epithelial cell with a little clear zone around it. Instantly, you know it's too big to be a nucleolus. So whenever you see a big intranuclear basophilic inclusion. Think of CMV. This is congenital cytomegalovirus disease. And the liver basically has a hepatitis because of it, and I think I could convince you that these are inflammatory cells. But remember, these cells are just hematopoietic cells. And the overall hepatic architecture remains preserved. But the spectacular changes now are right next door in the kidney. Here's the capsule of the liver. Here's a section through the kidney. But look how some of the tubules in the kidney already look like they have enlarged cells. You know, this is not normal for any stage of life. And the spectacular finding here is that virtually every single one of these enlarged tubular cells has another huge intranuclear basophilic inclusion. This is all over the kidney. You don't have to look hard for this. This is massive CMV infection of the kidney as well. And look at it's all out here. All these nucleoli are here, 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 here. It's any random place you go to in the kidney, you're probably going to see them. Here's a section of kidney in which we can't see too many big obvious ones yet.
Symptoms: swollen lymph nodes, especially in fever, fatigue, muscle ache, acne, sore throat.
CMV is a common viral infection most often seen in young children. It usually is harmless and does not cause symptoms. But when a pregnant woman becomes infected, she can pass the virus to her baby. This can lead to serious illness, lasting disabilities or death. Cytomegalovirus is a virus belonging to the herpes virus family. Although cytomegalovirus infections are very common, most people who have the infection do not feel sick or even notice the infection. Cytomegalovirus spreads directly through person-to-person contact and indirectly through the air when an infected person coughs or sneezes. Cytomegalovirus symptoms. Most people who have a cytomegalovirus infection do not experience any symptoms at all, although you may develop symptoms such as fatigue, fever, sore throat, headache, swollen glands. People with weakened immune systems are more likely to have symptoms which may be severe and can affect different organs in the body. Cytomegalovirus treatment. If you have symptoms after being infected with cytomegalovirus, CMV, for the first time, painkillers that are available from pharmacies, such as paracetamol or ibuprofen, can help relieve the symptoms of fever and pain. Children under 16 years of age should not take aspirin. Drinking plenty of water or unsweetened fruit juice will help relieve the symptoms of fever and sore throat, as well as preventing dehydration. An antiviral medicine like ganciclovir, brand name Kevivin, is often used to treat CMV. However, it cannot usually be given during pregnancy. Antiviral medicines cannot cure congenital CMV infection but can slow its progress. Cytomegalovirus is a common disease, yet every individual needs unique treatment and care. We encourage people with cytomegalovirus and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about cytomegalovirus and how to treat cytomegalovirus, just click on the link at the description or visit www.md.com. Thank you.
Treatment. Currently, there are two drugs for the treatment of congenital CMV, ganciclovir and its product valganciclovir. Treatment with intravenous ganciclovir for 6 weeks prevents the development of progressive hearing loss in children with symptomatic congenital CMV infection and central nervous system.
Actually, under the microscope, makes the cells like giant cells or something. They look very big, and so the name cytomegalovirus. In a simple manner for the lay person, I think it's the model that we will know about chickenpox and measles and German measles, childhood illnesses, is a good example of how most things respond with cytomegalovirus. First of all, the vast majority of the population has been exposed and has had cytomegalovirus. It often will happen in childhood or adolescence, teenage years, early adulthood. It will be exposed through some kind of intimate contact, whether it's a sneeze or a kiss or something else. Sexual activity possibly can do it. It shows itself as an influenza-like syndrome. Fever, you don't feel well, you're not hungry, you're nauseous, you're vomiting, you don't want to get out of bed, you want to sleep, you're dizzy. It looks like a flu. And for the vast majority of people, they will have, quote, a bad flu with maybe 102 fever. For an adult, that's a lot of fever, and it will pass, and that will be the end of it, and they'll think that they just had maybe some kind of a flu, the seasonal flu or something, and in fact what they had was a CMV. When a mother who is pregnant gets CMV, it is a different circumstance. And it crosses the placenta, it infects the fetus. The fetus has an immature immune system, and so in the fetus it can cause much more severe infection. It can cause encephalitis, it can cause hepatitis, it can cause blindness, deafness, similar as German measles can, rubella can. It can even cause death of the fetus. It can cause the fetus to go on to have a chronic shedding condition where they will shed virus for years and years. Mental retardation. It's a bad disease to get during pregnancy. And like the same example with rubella, if someone has had it as a child, they're basically immune to whatever getting it again. They're never going to get it again. They have antibodies. If you see the virus in your bloodstream, it stimulates the production of antibodies. These antibodies attack the virus, and the virus then cannot attack your cells and establish another infection. Especially can't cross the placenta or infect the baby, even though the baby has never seen the virus. Babies will have their mother's antibodies through pregnancy and up to about 3 to 6 months after the delivery of neonatal life. So babies will generally be protected from these kinds of vaccines, from these kinds of viruses. IgG shows us that someone has had an infection in the past at some indeterminate date and now has immunity to that virus. IgM shows that someone, if it's high, has had the infection on a more recent basis and is either fighting it or has the infection at the present time. Normally, as time goes by and you're in a convalescent phase, the IgM levels go down to a lower level, the IgG levels stay somewhat elevated. If you're ever exposed to CMV 5 or 10 years later, both levels will initially go up, but the IgG levels go up much higher and stay higher longer. And this is what will inactivate the virus from ever reinfecting your cells. A large percentage of the population is CMV positive. It does not mean they have the virus at the present time. It means they've been exposed to the virus in the past and are now immune, just like it would mean they've been exposed to German measles or chickenpox or regular measles in the past and are now immune. The question comes up as to what kind of a donor to get, whether you get a donor who's CMV positive or CMV negative. To some degree, it depends on who the recipient is going to be for that donor. And if it's someone who's CMV positive, that woman's been exposed to CMV in her past, it makes no difference at all. She's immune. She will protect the baby with her antibodies from ever getting a CMV infection, and she can work with either a CMV positive or CMV negative donor. The CMV negative recipient, a little bit of a different story. While she will not get CMV from the donor, if for some reason, random chance, she should get CMV during the pregnancy, this is a disaster. And that pregnancy, if we can pick it up before the 24th week, that pregnancy is at high risk for encephalitis, for neurologic problems, for hepatitis, and even fetal death. While it will not affect the mother that way, it will affect the baby that way. You know, you got to talk to your obstetrician at that point in time. If it's documented from an infectious disease person or a high-risk obstetrician that someone has actually picked up a CMV infection during pregnancy, about possibly terminating the pregnancy. But short of that, again, there is basically no risk if a CMV negative recipient gets a CMV positive sperm donor. The chances of getting CMV from that sperm is virtually zero, because this is someone who's had it many, many, many years ago and is just immune to CMV at this point in time. If we ever have someone who converts from CMV negative to CMV positive who's a donor, we have to quarantine those specimens and get rid of them until we know that the donor, his IgM has gone up and gone back down, and his IgG is up. So he's no longer infectious for the virus, and he's now immune to the virus himself. And then we can allow that donor to be sold again, but now marked not as a CMV negative donor, but a CMV positive donor. And that's why we initially have to test every donor at regular intervals, and this is something mandated by the federal government.
Treatment with oral valganciclovir can be excellent alternative due to its good bioavailability, allowing you to achieve similar plasma levels to those achieved with intravenous ganciclovir. Conclusions. Treatment symptomatic congenital CMV disease with valganciclovir for 6 months as compared with 6 weeks did not improve hearing in the short term but appeared to improve hearing and developmental outcomes modestly in the longer term.
Chapter. Ladies, thank you so much for being here.
Thank you.
Doctor, I think first off we need to explain what the virus is.
Sure. CMV, or cytomegalovirus, is a virus that all of us usually get at some point during our lives, but it's usually silent. We don't even know that we've contracted it, and we have no consequences from it. The concern is when a pregnant woman develops cytomegalovirus during her pregnancy, or if a person is compromised with their immune system, then it can have serious consequences.
I don't know about this. Why is that? Why have we never heard about this?
Well, that's one of the reasons that we're here today, is to try to educate the public about cytomegalovirus. Unfortunately, less than 20% of men and women in the United States are aware of cytomegalovirus, and what we're trying to do is increase public education.
So what is it that expectant moms should know about this?
Well, cytomegalovirus, if you do contract it during your pregnancy, it can cause serious problems, hearing issues, vision problems, small brain neurological problems, seizures, etc. So there are a lot of potential negative consequences. The majority of babies, even if the mother does contract it during pregnancy, will not have problems associated with it. But there are things that you can do to prevent cytomegalovirus transmission. And the things that you can do is, while you're pregnant or shortly before you plan on becoming pregnant, is to make sure that you're doing good hand washing around toddlers, when you change diapers, because it's a human-to-human contact, and it's usually through bodily fluids. So to avoid getting bodily fluids, contaminating yourself with bodily fluids is very important.
Got it. And Louise, we'll bring you into the conversation here. You lived this with your daughter, Elizabeth. She made it till she was 16 years old, but tell us a little bit about her.
Well, I ran a daycare center in my home. I lived in Maryland at the time. I was licensed daycare provider, so I went through all the things that the government makes you do to become licensed, and nowhere in the literature does it say that women of childbearing age should be mindful of cytomegalovirus.
There's some pictures up of you
and
Elizabeth there.
Actually, this is right before she was about to have a seizure. We went to New York to my parents because she had to endure several surgeries. She was born severely disabled because I caught it. Women who work in daycare are more susceptible to it, and if you have a toddler in daycare, because you're not supposed to kiss your toddler on the mouth or share cookies with them, especially if they're in daycare. I didn't know any of this. But anyway, Elizabeth was born severely disabled, as you can see from her pictures. We knew immediately because she had a very small brain when she was born, very small head.
But this is ultimately preventable if you do have the information, if you do know about it.
Right, if I knew about it, if I had known about it, maybe what I would have done is not do daycare for young children in my home, especially. Because remember, when you're picking up toys,
they're dirty, I get it, right?
But that's why children 2.5 and younger are the majority of the ones spreading it. Because they're mouthing toys and slobbering over each other. So I might not have done daycare in my home, or if I had known about it, I wouldn't have picked up toys and then grabbed an apple. I might have maybe even worn rubber gloves to pick up toys. I might have,
It's just so important to get that information.
Yeah, you just need to really wash your hands. And like I said, nobody really realizes you shouldn't be kissing your toddler around the mouth, because they reach up to you with those cute little lips. But if they're in daycare and you're about to become pregnant or are pregnant, you really just need to kiss their cheek.
Got it.